Someone dropped a comment saying that she feels that before she went into her reproductive era.
Career, yeah.
Yes, she already saw the signs of PCOS. Is that possible?
Yes, very possible. Delay menses is one of them. Childhood obesity is one of them. So probably these are things that she saw and she was curious. These days you find out that a lot of girls, they start the age of menarche, it's as low as 9 years. If at the age of 13, 14, 15, a teenage girl is yet to menstruate, something is wrong somewhere. You become curious to find out why she's not menstruating, because her peers, you see that her peers are all menstruating. So why is she not menstruating?
Yeah.
Although we don't start all the necessary investigations at that age, but again, they begin to like, something must be wrong, Yeah. So that's just the truth.
Okay. And welcome to Healthcare Today. On this program, we bring you all the health happenings around Nigeria. My name is Aisha Sadona. On today's episode, we'll be discussing Polycystic Ovarian Syndrome, also known as PCOS, and we have a doctor in the house. But before we get into what we have for you today, let's take our very quick break. And when we return, the program continues. Welcome back. If you're just joining us, this is Healthcare Today and I am Aisha Sadona. Before we went for our very quick break, I told you that our topic of discuss today is Polycystic Ovarian Syndrome, also known as PCOS, and we have a doctor in the house. You're welcome on the program, sir.
Thank you, ma'am. Thank you for having me.
Thank you, sir.
Yeah.
Please, can you introduce yourself for
My
our
name
viewers?
is Dr. Moloko Victor. Yes.
Okay.
Yeah.
So please, can you tell us what is Polycystic Ovarian Syndrome?
Yeah, when you talk about Polycystic Ovarian Syndrome, the major features of Polycystic Ovarian Syndrome includes menstrual dysfunction, anovulation, that's inability of a woman to ovulate, and signs of hyperandrogenism. Okay? Although the exact etiopathogenesis of the condition is unclear. However, it can result from abnormal, function of the hypothalamic pituitary, ovarian from this axis, that's HPO axis. Okay, a key characteristics in this is inappropriate gonadotropin secretion, which is more likely a result of rather than a cause of. All right, is a result of rather than a cause of. Okay, ovarian dysfunction. In addition, one of the most consistent biochemical features of PCOS is a raised plasma testosterone level.
What are the causes of PCOS?
There's no major cause per se. However, there are associations. That's just it. Well, this disease was first discovered by Stern and Leventhal. Okay, they were forced to discover it when they found the association between the presence of polycystic ovaries and signs of hirsutism, that's excess hair. You see some women with a lot of facial hair and stuff, and then absence of menses, which is amenorrhea. All right, for instance, you see some women, they have scanty menses, they have obesity. These are signs that you can actually find in some of them. All right, then some women diagnosed with Stern-Leventhal syndrome, which is the same thing as PCOS, underwent successful wedge resection of the ovaries. All right, their menstrual cycles became regular, and they were able to conceive. Why? For some people, they did the same thing, but they were not able to conceive. All right. As a consequence, a primary ovarian defect was thought to be the main culprit, and the disorder came to be known as Polycystic Ovarian Syndrome. So from this explanation, you can see that, yes, it was found initially at that stage that the major problem was from where? From the ovary alone. But however, a lot of discoveries, came up, and then it's been found that women with, this syndrome have abnormalities in the metabolism of androgens and estrogen and the control of androgen production. High serum concentration of androgenic hormones such as testosterone, androstenedione, and dihydroepiandrosterone sulfate. These are hormones that I don't want to bore you with some of these things. This may be encountered in these patients. Okay, however, individual variation is considerable. Okay, and a particular patient may have normal androgen level, which we've seen, yet they have PCOS. Yes.
Okay, some common features of symptoms rather of PCOS could be the facial hair that you just mentioned, and also loss of menstrual periods. Yeah, but I want you to give us more symptoms that we can look out for.
Yeah, the other symptoms, just like we said earlier, includes hirsutism, growth of hair all over the body, but quite often you see it on the face. Then infertility, that's inability to conceive. When you talk about infertility, when a woman is married and has been having, intimacy with the husband for 1 year, at least 3 weeks, 3 times in a week for 1 year, without conceiving. That's when we begin to talk about infertility. Then some you have obesity. Obesity is a major feature too for some. That's not to say that some people you may find them they are not obese, but again, obesity is one of the things, and then metabolic syndromes. Then you find out that some of them may have diabetes. There's a link between PCOS and diabetes. Then they have what we call obstructive sleep apnea. Okay, so these are the things you find in some of them. Okay, then for some of them you see that they don't menstruate at all. They can stay for months without menstruating. When the menses come, it just comes in drops, which is abnormal. Yeah. For some, again, when it comes, you see it, they flow heavily. So it's neither here nor there.
So can a woman live with PCOS without any symptom?
It's possible, but rare. That's the truth. In medicine, never say never. That's just it.
From our viewers, we already told them that we are going to have a discussion with you. So someone dropped a comment saying that she feels that before she started she went into her reproductive era. Yes, she already saw the signs of PCOS. Is that possible?
Yes, very possible. Delay menses is one of them. Childhood obesity is one of them. So probably these are things that she saw and she was curious. Okay. These days you find out that a lot of girls, they start the age of menarche, it's as low as 9 years. If at the age of 13, 14, 15, a teenage girl is yet to menstruate, something is wrong somewhere. You become curious to find out why she's not menstruating, because her peers, you see that her peers are all menstruating, so why is she not menstruating? Yeah. Although we don't start all the necessary investigations at that age, but again, they begin to something must be wrong, Yeah. So that's just the truth.
Okay. So does PCOS have a cure?
Yes, it has a cure. It can be managed. Cure. It can be managed. That's the truth. It can be managed. There are different ways it can be managed. Like I said earlier, it's one of the major causes of infertility. And the joy of every woman is when you're married, you have to, you conceive and then give birth to your own children. When the kids are not forthcoming, what happens? It becomes a problem. That's the truth.
Okay. Yeah. So for that lady that we just spoke about, saying that she started noticing her signs at an early age, can it be prevented?
Not really. Not really. Just like I said earlier, it's not possible, because this is something that has to do with the HPO axis. So how do you prevent it? How do you know who is going to from birth? How do you know who is going to have PCOS and who is not going to have PCOS? It becomes difficult. It's just like other ailments too. Other debilitating ailments that one can develop in life, and you begin to like, oh, is it possible for me to? Yeah, some of them can. Things like hypertension can, but again, you don't know who is to develop it. Except when there's family history, you begin to tell them, yes, to be careful. These are the do's and these are the don'ts. But apart from that, it's going to be extremely difficult.
Okay.
Yeah.
So lastly, sir, in Nigeria today, can you tell us the statistics of women with the cases of PCOS?
That honestly, I don't have, but a lot of studies are still ongoing.
It's rising.
Yes, you see a lot of people, newly married ladies coming up with, such. But however, the best bet, when such things are noticed, subject the individual to necessary investigation, not unnecessary investigations anyway. Necessary investigation. There are criteria for diagnosis of PCOS, So once one is subjected to, clinical examination and then necessary investigations, you find out that yes, you may be able to come up with a diagnosis, and the actual treatment will be given to the individual. That's the truth.
Thank you so much, sir, for sharing your expertise. It's been an amazing and educative session with Dr. Modoko. Thank you so much for staying with us.